Good evening. I'd like to welcome all of you to tonight's panel, How Do We Serve the Underserved People in the Portland area in terms of health care? This morning, I had the privilege of going to my doctor for my annual physical. And I was reflecting on that in light of tonight's panel because there was absolutely nothing wrong, but my doctor spent an hour and a half talking to me. Now that is only because I have the privilege of very, very good health care. And so it is with great gratitude that I welcome our 4 panelists this evening because they are helping the people in our area who do not have adequate health insurance. So they're filling in those gaps so that people who are in need are receiving good health care. So now I'm going to turn this over to Pam, and she's going to tell you a little bit about our program.
Thank you so much, everybody, for coming out. I want to talk to you about tonight's panel. It's a part of Spring into Service. And this is our 3rd annual Spring into Service at Marylhurst University. Our theme for this Spring into Service is Good Health Within Reach of All. And it is about creating awareness about accessibility to healthcare for everyone. We had 2 panels. One was with Marylhurst last week, and this panel tonight. And we also have 3 other direct service event, which was a clinic cleanup and a blood drive and a personal care drive that is still going on until the end of this month. So I would really encourage you to bring in personal care items and drop them off through the various boxes on our campus. So we are going to start off tonight's panel by just having our panelists just speak about their organization. So Genevieve?
Thanks. My name is Genevieve, and I'm with the Coalition of Community Health Clinics. We are a nonprofit organization that is dedicated to helping people from underserved communities gain access to health care that is affordable and culturally appropriate. And we do this through our network of 14 safety net clinics. And by safety net, I mean that they serve people with low incomes and people with barriers to accessing care, which could be anything from cultural or language barriers to disabilities, immigration status, fear. So my title is Program Associate, and I support a lot of the Coalition's shared programs that help our clinics meet their patients' needs.
Excuse me. My name is Dawn Latelli. I'm sitting in for Kate Messina. I'm the front office supervisor at Rosewood Family Health Center, and Kate is our administrator. Our clinic is part of the coalition of clinics in the Portland metropolitan area, and we do serve the underserved. Rosewood is part of Yakima Valley Farm Workers Clinics, which I don't know if you guys know, they started back in 1978 serving the migrant workers to provide health care for them. And it emerged into serving the underserved. And we see approximately about 43% Medicaid patients, and about 34% children of them are children, and about 19% are the uninsured, and 2% I would say are commercial type insurance. And a typical patient that comes to us is usually on Medicaid. We do take uninsured, but unfortunately right now our panels are full. We have limited access because we have limited providers right now. So we do plan on trying to open up our doors for the uninsured, meaning they have no insurance whatsoever, no Medicaid, soon in the near future. It's not determined yet when that will be. And I also wanted to share with you, there was a question regarding, okay, all right, we'll do the questions later. Anyways, that's it, thank you.
Hi, my name is Ted Amon. I'm the Director of Health System Development for Central City Concern, and a lot of what I'll be talking about tonight is regarding our Old Town Clinic, which is a primary care clinic that's located in downtown Portland, right at Burnside and Broadway, where the old Burger King used to be. We're right near there. But Central City Concern also does a lot of other programs. Our goals are to try to help people achieve self-sufficiency and break the cycles of poverty and homelessness. So working towards that, we have traditional healthcare programs. We have behavioral health programs, both mental health and substance abuse treatment. We run the Hooper Detox Center in Portland. We also provide housing. We're the lowest provider of low-income housing in the Portland area. We have about 1,600 units of housing that we provide. We also provide employment services, help people get income so they can get self-sufficient again, as well as we have a program to help people who are just never going to be able to work due to disabilities to help them get the disability benefits that they're entitled to.
I'm Jill Sanders, and I'm the Dean of Clinical Operations at the National College of Natural Medicine. And we too are members of the Coalition of Community Health Clinics. And I listened to you guys talk, and I realized what diversity the coalition really has and offers to the Portland metro region. We got into the business of helping serve the safety net back in the early 90s, and my predecessor running our clinics, our student clinics, tells the story about how he was out one day and saw what appeared to him to be a mom and two kids waiting at a bus stop, and he, for some reason, what struck him was where is that woman getting health care for those kids and herself, you know? And he made a lot of assumptions about who she was, but he kind of like used her as a symbol for his thoughts about this, and he was thinking, where is she getting health care, and where is she getting good quality health care, and where is she getting the kind of health care that can take them to the next level of health in terms of understanding how nutrition plays into health and how exercise plays into health, especially with kids. And he came up with the concept of moving our training of students, naturopathic medical students and Chinese medicine students, out from our campus out into neighborhoods and offering our services to neighborhood areas. And we have grown, we're one of the CCHC clinics that Genevieve spoke about, but we actually have 18 locations, and so we're kind of like one, but then we are spread out across the Portland metro area ourselves, and we actually send Chinese medicine interns to both locations, Rosewood and Central City Concern, and have associations with a number of different clinics, healthcare sites. We have clinics at churches and at Portland Community College, and we try to get the clinics out to where there's a population that has a need for basic primary care services, or in the case of acupuncture and Chinese medicine, addiction services, pain relief, some sort of supportive services to primary care. And we have been doing this for some 20 years now, and trying to get what seems to be kind of like an elite medicine that people have to pay for, out into populations that can really benefit from the kind of care that we can offer.
Great, thank you each very much. And as you said, it does sound like there's a great diversity within the coalition in terms of services and clients. One of the questions that we have is we would like to know what a typical client might come to you with. What kind of person might you see? What might their needs be? So if you could tell us a story about a typical client. I know there is no such thing as typical, but just a client. We would appreciate that.
Well, at the Coalition office, we
hear from clients every day. They call into the office. Many are uninsured, and they're looking for somewhere to go to get health care. But others, for example, someone I talked to the other day, he had insurance, but there was a $1,000 deductible. So meaning he has to pay the first $1,000 out of pocket before the insurance will reimburse him for anything. So we call this underinsured. We see a lot of underinsured patients that have insurance, but it really doesn't do them much good. I recently talked to a man who, his son was sick, and he wanted to take him to the doctor. He needed to go to the doctor, but he was undocumented, and so he was afraid of going into that clinical setting and being asked for paperwork that he didn't necessarily have. And he was also, the English was not his strongest language, so there was a language barrier there. And so I reassured him that our clinics don't ever ask for any kind of immigration documentation, and they try to create a safe space for people to come in and receive health care. And we try to provide language interpretation services because it can really affect health outcomes having those services. So those are just a couple examples, but we receive calls from students, everyone, basically, a lot of people.
And I think I can echo that. We do see a lot of those types of patients as well. We're a very diverse clinic. We do provide interpretation for every patient that needs an interpreter for almost every type of language. And the typical patient that we do see is kind of like what Jill was saying, the mom standing at the bus stop with her 2 kids. We do see OB patients. We see the chronically ill patients, patients that have diabetes or hypertension or high cholesterol, hyperlipidemia. We're a family practice, so it's pediatrics to geriatrics at our clinic. And we do not lack for patients trying to come to our clinic. We serve the Portland metropolitan area, and we're busy every day. So.
Well, we see probably about 2,800 unduplicated people a year in the primary care clinic, but about 5,500 throughout all of our health and recovery service programs. And there's a lot of different stories, a lot of different ways that people come to us. Some folks are caught up in addictions and they end up entering the system through Hooper Detox. They get clean and sober there. From there, they move into alcohol and drug treatment, get into medical treatment as well. Some folks come to us off the streets just looking for health care, and then it's through that door that we connect them with other services. But I found one story that actually I thought was pretty good. It's just sort of indicative of some of the stuff we deal with. So there's a 53-year-old gentleman who was paraplegic, polysubstance abuser, multiple mental health issues, had chronic ulcers from sitting too long, not being able to move around. He had chronic hepatitis C, and he had a gangrenous foot that had multiple amputations. They were slowly whittling away at it because it just wasn't healing. He had called 911 9 times in the 18 months before we saw him. And when we finally got him into care and we looked at overall his hospital records, he had 50 problems on his problem list in his medical chart. The way he came to us was through a program we have called the Recuperative Care Program, which is a partnership we have with local hospitals, where when they have somebody in the hospital who's homeless and needs to have ongoing care after they're discharged, they need an option. For those of us who have more commercial insurance, if I needed 6 weeks of IV antibiotics, I would go home and I would have home health care, and I would have nurses that my insurance company would pay for that would come to my house, and they would help infuse IV antibiotics every day. But if you're homeless, you can't get that. They don't do home health nursing under the bridge. And so the partnership we created with the hospitals was they can discharge patients like that in that situation to us. We'll put them in one of our transitional housing units, and we'll connect them with the Old Town Clinic for primary care. And then that way they're getting the ongoing medical care. There's a housing, there's a place that if they have home health nursing or other services that are coming out to them, there's a place where that can happen. And then we also can transport them to follow-up specialist appointments and programs like that. So he was with us for 86 days, getting daily wound care. We got him through into supportive housing, and then when he was healed up enough and ready to leave that transitional program, we were able to secure permanent housing for him, and he's stayed engaged with us for primary care. His wounds have healed, and he's had 0 emergency room visits, and he did have 1 hospital visit, but that was for a legitimate medical issue that nothing we could have prevented. But that's a fairly typical client. The people in the situations we're dealing with often have very delayed care because of their income, homelessness, mental health, addictions, whatever issues they're dealing with often prevent them from getting care in a timely manner. So unfortunately, by the time they get to us, things are really in bad shape, and then we have to play this catch-up game to try to get things under control.
So, typical patient in our community clinics, if you can think of there being one, we probably serve more of the working poor than an organization like Central City Concern. We have some locations where we're seeing homeless, but the people that I think of us seeing are the working poor or people who are unemployed and don't have access to health insurance, and they're not necessarily seeking naturopathic medicine, they're seeking health care. And because of our association with the Coalition of Community Health Clinics, we are able to get referrals from people who are just seeking basic health care. I talked with one of our physicians who works at a clinic that we opened up this past year at Rosehaven, which is a day shelter for women who have experienced domestic violence. And she said that it's just the clientele there is pretty amazing because these are women who have not had health care in years, that they haven't been able to access any kind of health care for, an annual physical exam, any kind of basic blood work, so that the level of gratitude that she's feeling from these women is pretty high. We're able to offer annual physical exams to men and women and children, including low-cost labs, so that they can actually start working on their health from the baseline that they're at when they first come to see us. But it's really typically somebody who is looking for basic health care, somebody to help guide them in their taking care of themselves.